Well, a warm welcome to this video. Now, I was in the supermarket today and I noticed some vitamin D tests for £5. That's about, what, $6 or $7. And I took it home and I did it. And if you haven't got time to watch all of this video and to learn about what I consider to be the relatively ridiculous guidelines from my National Institute for Health and Care Excellence, the people that make up how doctors operate in the UK. We'll talk about that towards the end. But if you haven't got time to watch, I was disappointed to learn that my vitamin D levels are probably insufficient at 10 to 30 nanograms per mil. Now, that's despite me taking 4,000 to 8,000 units of vitamin D a day for the past 6 weeks, couple of months. Now, of course, I'm not telling you what to take. This is just what I've been taking. The problem is some people could take 4,000 units and be relatively high in vitamin D. Other people can take 10,000 units and be relatively low on vitamin D. We need to titrate it for individuals. And the guidelines in my country instruct doctors not to do that unless there's particular bony reasons to test for vitamin D. I'll tell you exactly what they are later on. But that's what this video is about, so pretty disappointing. We've talked to leading professors, leading consultant physicians around the world, and many of those tell us that the most important thing that we can do to improve public health in the Western world is to make everyone vitamin D replete. And yet I seem to be low on 8,000 units a day, and the guidelines say not to test, meaning we have to resort to sort of cheap £5, $6, $7 supermarket tests. Anyway, enough of the rant. Let's look at the test and then we'll consider the guidelines in more detail. Right, so let's give this a go and see what happens. So, you're supposed to clean your finger with this alcohol swab first of all. There we go. And you get a pricker. These prickers all work in slightly different ways. Let's see how this one works. Okay. And then we've got a little thing here to draw some blood up, and it's a capillary action. So maybe zoom in a bit so you can see that better. Trying to get the blood going into the tube. Yeah, you can see it's going into the tube there. Which way around? There we go. We need to be up to that black line. There we are, we're up to that black line, so that's good. Then S here is for sample, so it's a bit like a COVID test. So we put the whole sample in there. Not that I've done this before, but and we've hit the wall and missed. There we go. Right, so there is my blood sample. And then confusingly, B here stands for buffer, so we put in 2 drops of buffer. 1, 2. There we go. And it's a bit like a COVID test. So we're going to have a control line up here. And we're going to have a test line just there. But we have to wait for 10 minutes, so we take a note of the time. 10 to 10. And we'll come back in 10 minutes at 10 o'clock and see what we have got. Actually, you can just see the reagent starting to rise there through the capillary action in the tubule. I'll just show you the way this test works actually. So here we have the coloured lines we're looking for. It's very crude. So it's just basically going to show whether we've got deficiency, which is 0 to 10 nanograms per mil, which is 0 to 25 micromoles per litre in English measurements. So the less that's in, the darker the line will be. So that'll give you the darkest line. The medium amount, 10 to 30 nanograms per mil, will give you a medium line. If there's sufficient, that's 30 to 100. That'll give you a lighter line, and if you've got too much, that'll give you no line at all. So the darker the line, the lower the level. The lighter the line, the higher the level. So hopefully we're going to get in this range here, which is 30 to 100 nanograms per mil, which would be 75 to 250 nanomoles per litre. And actually already you can actually see there's a line forming there already. And that's only after a minute and a half. See if we can see that a bit more detailed. Yeah, so already we see I haven't got excess. So it looks like I might be slightly on the low side actually, which is quite interesting. So we're getting a line there. What we'll have to do is compare this line here, the test line, with the control line there, and look at the relative darkness of those lines. Right, we'll come back in 10 minutes and the remainder of the 10 minutes, and we'll see what it looks like. Okay, so our 10 minutes are up, at least according to what this test requires. Now, I have to try and compare my test line with the line they give. So that's the test line you would get there if you are deficient, 0 to 10 nanograms per mil. So I'm probably not too far off that by the looks of it. This line here is probably what I'm closest to, I would say, although it is pretty subjective. That will give me a level of 10 to 30 nanograms per mil, which is insufficient. The sufficient line, 30 to 100 nanograms per mil, well, I don't think my line is that faint, do you? I think that line is fainter than mine, so I don't think I'm sufficient. And I'm certainly not excess, because you can see a line, and with excess you would see no line at all. So according to this test, my vitamin D levels are insufficient at 10 to 30 nanograms per mil, which is 25 to 75 nanomoles per litre. It's a pity we measure these two different ways, but we do. In fact, if anything, I'd probably say I'm between those two lines. So that would appear to be my test result based on this relatively cheap, somewhat subjective, colour-coded test. But I would say that I am insufficient by this test. Well, I must say I'm pretty surprised by that relatively low reading, given that I've been taking 4,000 to 8,000 units of vitamin D a day for the past 6 weeks at least, and quite a lot before that as well. So quite surprising. Is this test inaccurate? Possibly. It's just a £5 supermarket test. Is there something wrong with the vitamin D I've been taking? I've just been getting vitamin D from online sources and from supermarket sources, the same as you. So you would expect it to contain what it says on the bottle, but those levels are relatively low. Just shows how individualized this needs to be. And based on this test, it looks like I need to probably pretty well double my intake. It's a bit confusing, really, which is really why doctors should test for this. We shouldn't have to rely on subjective £5 tests from the supermarket. Now, this is the nice guidelines on the matter here. So this is what it says in the nice guidelines. Now, I'm just going to go through these so we can see exactly what the position is. Now, this is from the National Institute for Health and Care Excellence. So these guidelines are obviously excellent. They're nice. National Institute for Health and Care Excellence. You know, if you've got to put excellent in the title, it really makes you wonder. You know, it's like in the Soviet era, any country that ended in democratic probably wasn't as democratic as you'd like it to be. Anyway, let's go on and look at what it says. These are the guidelines here. Do not routinely test for vitamin D deficiency in people who are asymptomatic. So I'm asymptomatic, but I think I should be tested for vitamin D deficiency because it's going to reduce my risks of heart disease and diabetes and cancers and also dementia, all sorts of things we've looked at. This is probably the most important aspect of public health that's simply ignored. frustratingly, it's almost as if the people that wrote these guidelines aren't interested in whether people are vitamin D replete or not, which is really quite strange. Anyway, that's the link. Check it out for yourself. The guidelines say check the vitamin D levels by measuring 25-hydroxyvitamin D if a person has musculoskeletal symptoms, suspected osteomalacia. So osteomalacia is like softening of the bone, usually impaired metabolism. It could be shortage of phosphate, calcium, or vitamin D. That's osteomalacia, but it's not something you see commonly. Chronic widespread pain or other features of osteomalacia, such as proximal muscle weakness towards the end of the limbs. Suspected bone disease that may improve with vitamin D treatment, such as osteomalacia or osteoporosis. So osteomalacia, as we've said, is the softening of the bone. Osteoporosis is just loss of bone mass, really. Porous bone, making it more likely to a fracture, particularly common in older people, especially older women. Known bone disease where correction of vitamin D deficiency is needed prior to specific treatment, such as prior Paget's disease. Now, Paget's disease is I didn't check on the incidence, but it's pretty uncommon, Paget's disease, actually. It used to be called osteitis deformans, and you get sort of irregular bony breakdown with irregular bony remodelling, and you get sort of dense bits of bone and less dense bits of bone associated with bone pain and shooting pains, but not common. So there you go. Nice guidelines. Not that helpful, really. Do not routinely test vitamin D deficiency in people who are asymptomatic. And yet I appear to be low. And we know it's got massive amounts of health implications. So, rather unsatisfactory situation, I would have thought, from the National Institute for Health and Care Excellence. So, what do I do? Do I try a different brand of vitamin D? I can't go out in the sun because there isn't any. I live in the north of England. And even if you do at my age, you don't produce that much because my skin's not as oily as it used to be. So I guess I increase my dose of vitamin D, and I'm going to try a different test because I'm not 100% confident in that test. Of course not. But there we go. Given that doctors don't test, it leaves me in a bit of a difficult position. So I think what I'm going to do is I think I'll increase my vitamin D intake with the current vitamin D tablets I've got. I'll increase that to 12,000 units a day. Not telling you what to do. This is me. I'm going to increase mine to 12,000 units a day. And of course, the reason this matters is some people could take 4,000 units a day and be high. Other people can take 12,000 units a day and be low. This is the whole point. We need to get this bespoke titration. That's why we should be testing, to make everyone vitamin D replete. Then you know the kind of levels that you need. So I think I'm going to bunk up my vitamin D levels. I'll take 12,000 units a day for a week or two, and then I'll try and find a different test, I think. And I will try and talk my doctor into testing as well, but not much chance of that. Not much chance of seeing a doctor come to that in England. There we go, unsatisfactory situation. So I'll go up to 12,000 units a day. I'll try and find another test or buy another one of these tests and retest and see what I get. But that's the unsatisfactory situation. And on that unsatisfactory note, thank you for watching.